You've seen our research on social media. Now, join us as we dive deeper into the public health topics of our time, featuring new studies and findings generated by our faculty and researchers committed to advancing health equity. From the Department of Population and Public Health Sciences at Keck School of Medicine of USC, this is Preventive Pros, the podcast.
So hi, I'm Sandy Eckel, and I'm an associate professor of biostatistics in the Department of Population and Public Health Sciences at USC, and I'm also the director of the PhD program in biostatistics at USC. So I am a biostatistician, and my area of expertise is the development and application of statistical methods for air pollution epidemiology. I've spent more than 10 years studying air pollution health effects, and now I'm starting to shift into research related to climate change, and especially climate change mitigation. And I'm interested in how the actions that we take to try to reduce and improve our outlook in terms of a changing climate can also have major benefits in terms of our health and our quality of our environment. The context for the adoption of EVs is that here in California, we are really trendsetters in the adoption of EVs in the US. We, by far, have been purchasing the largest number of EVs and have the largest number of EVs on the road of any state in the US. And in terms of the context of the research, much of the research around the health and air quality co-benefits of electric vehicles has been in terms of projections. We know that an electric vehicle does not produce tailpipe emissions like internal combustion vehicles do, but most of the health benefits and air quality benefits to date have all been hypothetical based on assumptions. And so this research really sets out to try to see in a real world setting, do we see these health benefits? We're actually taking advantage of a natural experiment going on in California right now, where we've gone from a very low number of EVs in our neighborhoods to more and more electric vehicles. And so we're trying to see, using real world data, do we see improvements in health and improvements in air quality? So some of the factors that we want to keep in mind when thinking about the adoption of EVs are that there might be barriers in certain neighborhoods to the adoption of EVs. We noticed in our study that neighborhoods that have higher socioeconomic status, as assessed by the level of education in aggregate across the community, they tended to have higher adoption of zero-emission vehicles. And so one can imagine a number of barriers that there might be in communities that have lower socioeconomic status. For example, if you are in a multifamily dwelling, there might not be a place to charge your electric vehicle. First of all, the cost is more expensive for electric vehicles still, and so on. So there are a number of issues that could be barriers to the adoption of EVs. And this is a really important issue that we noticed in our study, and we've termed this the adoption gap. And so this is an important issue to think about as we move forward in this early phase of the transition to zero-emission vehicles. The big goal of our research is really to take advantage of real-world data on this natural experiment happening in California with the early phase transition to zero-emission vehicles and see if we document any real-world health benefits and air quality co-benefits. In terms of policy implications, the adoption gap that we noticed makes it really obvious that we need to think carefully about policies that are proposed in the future to try to encourage zero-emission vehicle adoption. Ideally, these policies would especially target communities where adoption has not been starting to take off yet, and think about ways to make sure that the health benefits and air quality co-benefits that we observed can be enjoyed by everyone. So in our study, we were able to take data from more than 1,200 zip codes in California and relate the increasing number of ZEVs, or zero emissions vehicles, in each zip code to trends in both air quality or asthma emergency department emissions. And for the asthma part of the study, we looked at these more than 1,200 zip codes and saw that zip codes in which there was a greater increase in the number of zero-emission vehicles, these had a trend of declining numbers of asthma emergency department visits. We also looked at air quality in relation to the trends in zero-emission vehicles, and we looked at a smaller subset of zip codes, 100 zip codes, where there were actual EPA monitors of air pollution. So we're using real measurements of air pollution. And we saw that these zip codes that had EPA monitors, as some of the zip codes had increasing numbers of zero-emission vehicles, we saw a trend towards declines in air pollution. Now, we had smaller power because we had only 100 zip codes with EPA monitors versus the 1,200 zip codes where we could look at the health effects. But these results are very suggestive that there are statistically significant health co-benefits of the transition to zero-emission vehicles, and there's some suggestive evidence in terms of the air quality co-benefits as well. So I'm really excited about the future, both in terms of continuing along with this study, because one feature of the study that's important to note is we were just looking at electric vehicle adoption from 2013 to 2019, and we saw a dramatic increase in the number of zero-emission vehicles. But since 2019, the pandemic occurred, which is why we had ended our study. But as we continue to move forward, there's been a really dramatic increase in the number of zero-emission vehicles in California. In 2019, I think we had about 8% of the market share of new cars sold were zero-emission vehicles. And in 2022, they recently released a statistic and we're up to 19% in California. So there is a potential for some very interesting follow-on studies to look and see what sort of health and air quality co-benefits we might be seeing at these higher levels of zero-emission vehicle adoption. These trends are going to continue. We have recently in California passed new regulation that requires that new car sales in 2035 will be no more internal combustion vehicles. And so as we move towards this next 10 years or so, we're going to really start to see some dramatic shifts towards more electric vehicle cars in our neighborhoods. And so I think it's a very exciting time to think about how our health in our neighborhoods can be improving as a result of these actions that we're taking to mitigate climate change. And so we'll be seeing health benefits and hopefully air quality benefits in our own communities in the near term, and in the future. I think our prospect is also bright. One of the things that I find to be really exciting about this line of research is that although climate change is scary, and it's been said that climate change is the greatest public health threat of our century, climate change mitigation can be the greatest public health opportunity of the century as well.
Preventive Pros, the podcast, is produced by the Department of Population and Public Health Sciences at Keck School of Medicine of USC. To learn more about any of our episodes, or to subscribe to our monthly Preventive Dose newsletter featuring the latest in public health research and news, visit pphs.usc.edu/podcast. Thank you for listening.